where 3 nursing homes have been ordered to repay Medicaid funds. Can you clarify why these facilities were singled out for such action?
Certainly. The state discovered that these nursing homes were operating with dangerously low staffing levels, which violated both state and federal requirements. Essentially, they failed to provide adequate care, yet still received public reimbursements.
That raises immediate questions about oversight. Is this sort of Medicaid repayment order common, or is it a rare measure?
It's fairly uncommon. Typically, penalties involve fines or corrective mandates. Forcing facilities to repay Medicaid is a stronger response, signaling a serious breach of trust and stewardship of public funds.
You mentioned dangerously low staffing. Why are staffing ratios so critical in nursing home environments, and what do regulations require?
Staffing ratios are foundational because residents often need help with basic tasks. Think bathing, medication, mobility. Federal guidelines suggest at least one licensed nurse on duty at all times and minimum nurse aid hours per resident.
Are there studies showing how staffing impacts resident well-being?
Absolutely! A 2022 study found that each additional hour of nursing care per resident per day correlates with a 9% drop in hospitalizations. Understaffing can mean missed medications, delayed responses, and increased injuries.
How do regulators actually determine if a facility is understaffed? What kind of evidence do they rely on?
They use payroll records, staff schedules, and surprise inspections. Sometimes, whistleblower reports trigger deeper audits. However, facilities may attempt to appear compliant on paper, so investigators cross-verify with resident care outcomes.
Are there technological tools that help spot chronic understaffing?
Yes, electronic health records and digital timekeeping systems can reveal gaps between scheduled and actual staff presence, enabling a data-driven approach to enforcement.
Let's delve into Medicaid's financial role. How are nursing homes funded, and what's the risk when care standards aren't met?
Medicaid reimburses nursing homes based on resident needs and reported staffing. If facilities inflate staffing or cut corners while accepting funds, it's essentially defrauding the program. That's why strict audits and repayments are crucial.
Could there be unintentional errors, or is most underfunding deliberate?
While some errors may be administrative, systemic understaffing often points to profit-driven choices. For example, a 2021 audit in Illinois found that 60% of chronic understaffing cases aligned with cost-cutting strategies.
Let's connect this back to residents. What are some documented effects of being in an understaffed nursing home?
Residents face increased risk falls, bed sores, malnutrition, even preventable deaths. Emotionally, isolation and anxiety surge when staff lack time for basic human interaction. A 2020 survey linked understaffing to a 40% rise in depressive symptoms among residents.
That's a significant human cost. Are there personal stories or case studies that highlight these issues?
Yes, one NJ facility saw emergency hospitalizations triple within 6 months due to missed medications and delayed wound care. Families reported calls for help going unanswered for hours.
Some advocates believe these Medicaid orders could catalyze broader reforms. Do you think this will prompt nationwide scrutiny of elder care standards?
It's highly likely. When a state takes decisive action, it sets precedents. Other states may re-examine their own oversight mechanisms, especially if federal funding is at risk. Already, states like California and Pennsylvania are reviewing their inspection protocols.
So could we see a domino effect in regulation?
Exactly. High-profile cases often lead to legislative hearings, increased penalties, and new minimum staffing laws.
From the operator side, what arguments do nursing home administrators make about staffing and funding constraints?
Many cite razor-thin margins and workforce shortages, arguing that increased mandates without higher reimbursements are unsustainable. They warn that too stringent rules could force closures, limiting options for families.
Is there data supporting their concerns?
A 2023 industry report found that 55% of rural nursing homes operate at a loss. However, critics point to mismanagement and excessive executive compensation as factors exacerbating these challenges.
Let's broaden our lens. How do other countries approach nursing homes, staffing, and elder care, and are there models the U.S. could learn from?
Scandinavian nations like Sweden use higher staffing ratios and integrate nurse practitioners into daily care. They allocate more public funding but see lower hospitalization rates and higher resident satisfaction.
Could those models work here, considering our healthcare system's complexity?
Adapting them fully would be challenging, but hybrid models like incentivizing staff training and career ladder shave shown promise even in U.S. pilot programs.
There's a legal and ethical side to this story. What obligations do nursing homes have? And what recourse do residents or families have if standards aren't met?
Legally, facilities must meet minimum care standards or risk losing licenses and funding. Ethically, they're entrusted with society's most vulnerable. Families can file complaints with ombudsmen or pursue legal action for neglect.
Are there barriers to reporting or pursuing accountability?
Yes, residents may fear retaliation, and families often lack legal knowledge. Improved transparency and whistleblower protections are vital.
As we wrap up, what policy changes or practical steps could improve staffing and care quality in nursing homes?
Increasing mandatory staffing ratios is a start, but must be paired with funding boosts. Enhanced training, real-time staffing audits, and family advisory councils also drive accountability.
Are there innovative technologies or community partnerships that could play a role?
Absolutely. Remote monitoring, AI-powered scheduling, and partnerships with local nursing schools can fill gaps and set a new standard for elder care quality.